We talked a little bit about long-term services, but let's talk about that in relation to infrastructure here. What can be done to resolve this imbalance between veterans who qualify for some of these and what they have to go to now?
So I can definitely say when it comes to specialty long-term services and supports, there are currently six long-term care facilities that are for veterans with spinal cord injuries and disorders in the VA care system. Currently, only one of those is west of the Mississippi River. A whole lot of veterans live in that part of the country. We have two facilities that are actually under construction right now, one of which will be coming online hopefully this spring, and then one a little further down the road. And those are a drop in the bucket in terms of the beds that are needed. So we would like to see more prioritization within VA's infrastructure. What are things that are difficult to provide in the community that VA needs to provide? One of those is long-term care for people who are on ventilators and need specialty type care. We literally have veterans who are spending more than 1 year living in an acute SCI center setting because there is no facility that will take the individual. They simply require too much care. The reimbursements are too low. Maybe it's not appropriate kind of care. And social workers can't even find a place to put this individual. So they are in a hospital setting for multiple years at a time. So that's really why we have so strongly advocated to say, okay, there are some services are really hard to buy. These are the services that VA being able to prioritize within its own networks to say, hey, how can we make sure that we are providing these services so we don't have veterans taking up an acute care bed for multiple years at a time because there's no place else to put them, actually get them in an appropriate setting and then have that bed be open for a person who does need acute style type care. So that's just one example from a specialty care perspective of where we've seen there are, like I said, precious few projects that are underway, but so much more is needed.
Yeah. And on the women's health clinics, VA has developed an excellent model. A number of facilities do have new women veterans clinics in them. They're wonderful. They provide, the privacy, the security to make women veterans feel safe and wanting to go there, and have all of the latest and newest equipment. And so, that's another key aspect as this women veteran population really increases within VA. And I would mention one last thing on dental care, which we haven't really talked about, but the independent budget has advocated for. Dental care has become, VA is a comprehensive healthcare system. It holds itself out to be a whole healthcare system, but it is missing one real key piece, which is dental care. Oral health is part of healthcare. We all agree. So we'd love to see this expansion within VA of providing dental care, and that requires infrastructure needs as well.
Mhm. Yeah, there is direct links from oral hygiene to heart disease, for example.
Absolutely.
So definitely.
Serious consequences, and just very few. It's very limited. I think about 800,000 veterans can receive some sort of dental care, but it's really just your 100% service connected or those with independent or IU, individual unemployability, or have a dental
Service connected.
Yeah. and just a few others. But that's a very limited, and many veterans really struggle to get their oral health taken care of. It's expensive, as we know, and really we'd like to see that as part of the VA benefits package.
But the IB is recommending a significant increase in long-term services. What's behind this recommendation, this big bump?
Well, really, we have the aging veteran population. So when you look at, we have, about 18 million veterans that are living. 8 million of those are over the age of 65. And we have, VA is projecting that its percentage of veterans who are age 85 and older is going to increase by 33%. So we're really starting to see a population, of folks that are, not just living past, retirement, we'll say, but who are living long past retirement. And the longer you live, the more likely, even if you don't have disabilities, your disabilities may, they may exacerbate as you get older. But then if you don't have physical disabilities, you may now acquire them as you begin to age, and need additional support. So we've recommended, I believe it's a $2 billion increase over and above for long-term services and supports, because anytime you're needing providing somebody to come into your home to provide home care, helping you get out of bed in the morning, getting to bed at night, helping with food prep, helping you with bathing, just basic things that we all need on a daily basis, many of them. We need to be able to make sure that our veterans are taken care of. So you have to have funding to do these types of things. Or if people need to be in facility-based care, having the funding that's available so that folks can access that in their community or through a VA community living center, if that's an option, or state veterans homes, other options. So there is just when you just look at the population, there is a significant need to make sure that we're not looking just at the acute care situations that folks need, but also that daily support that they might need in order to stay safe, stay healthy, and to be as independent as they can. Because most of us want to age and live in our homes, and that's usually more cost effective to be able to do that.
I think that independence is key, something that veterans yearn for, oftentimes, and especially our veterans getting older. I'm thinking of our Vietnam veterans here who are living with the long, lingering health aspects of Agent Orange exposure. And as humans get older, they require more care, and veterans are certainly part of that. And the VA must evolve to their patients.
But also, we have service disabled veterans that have had serious injury with TBI, and other very serious physical injuries. And as they age and they lose their support systems in their family, they don't want to lose their independence, because maybe they've been able to live with a family member or have some support there. So we've really pushed for like an assisted living component, because there are graduated steps and levels to that, where again, you may need just limited support to be able to remain independent. But that's going to change as you age. So those types of unique programs, especially for those who've suffered, war-related injuries, is so key.
Yeah. Yeah, and it's long-term services and supports, because it can be over the length of your life. So you may be somebody who's 25 years old, now has a spinal cord injury. You may need help every day getting in and out of bed, meal prep, whatever the case may be. And, if you live to be 85 years old, you're going to need that care now for 60 years. So I think sometimes when people hear long-term services and supports, they tend to think, oh, that's, my grandparents, old
Yeah.
people. And particularly as Joy has said, when you're talking about a population of folks who have served their country, in wartime situations, this, for some people, this is their life, is having those supports and services available. And the VA is kind of unique in some of its ability to provide those supports. So we have to make sure they do it well, because if not, people can suffer in silence in their homes with, well, the aide just didn't show up today, so I didn't get out of bed. Or maybe nobody came, so I didn't get any food today. Again, this is
Heartbreaking stuff.
right.
Yeah.
This is stuff that, again, we're not talking systems here. We're talking like actual people who then have harm done to them if this doesn't work right. That's why we all care so much.
Yeah, individual stories can tell more than the aggregate ever could, right?
Exactly.
Let's talk about another critical area here: mental health and suicide prevention. It remains a top priority for the VA and for veterans, quite frankly. What are some examples of the resources that the recommended increase would address in the independent budget?
I think we want VA to continue its suicide prevention efforts and to branch out, because they've been trying a number of things, grants with community partnerships, and a number of things. But I think we have to listen to veterans to meet them where they are, whether that's care in the community or with a partner, or in VA, and ensuring that they're going to get the help that they need. Because to look at suicide prevention, for example, we know that I think it's up to 70% of all veterans who do take their lives by suicide do so with the use of a firearm.
Mhm.
And we've said, we can't ignore that. We need to make sure that our veterans are safe. So we need to make sure that they can talk to their clinicians about that when they're in crisis or in a crisis period. We're going to have to look at these hard issues, which are hard and can be somewhat controversial at times. But, VA's trying to develop new programs through its REACH program, so an AI program who's really looking trying to look at who are at the highest risk for suicide, to prevent that, to go out to them, to do outreach to them. If they show up at an emergency room, VA's required to do a plan of action to make sure that they get to see a mental health provider when they, after that visit, that initial visit, and then try to really make a good plan for them for what they need, whether that's inpatient, outpatient care, or combination thereof. And we know that as a community, all of our organizations have worked to try to say, suicide in the veteran population is all of our business. So we need to look out for each other. We need to make sure we're supporting and we're able to talk about these tough issues. And it is a hard topic to talk about. But if we really want to change the trajectory and reduce veteran suicide, that's going to be essential, I think, for the future. So investing in those programs and services, investing also in making sure more community care options are available when VA doesn't have access, are all going to be key in the future.
And something that we really like to see kind of a shift in what VA is pushing is something that is kind of a personal pet peeve of mine when we hear that veteran suicide is VA's number one clinical.
That's what
priority.
Yep. They love to say that.
Love to say that it's their number one clinical priority. It's not only a mental health provider problem or solution. We need to look at not just the healthcare aspect of it, but also some of the benefits. What we say all the time, right? If you have food on your table, a roof over your head, money in your wallet, and you're gainfully employed, that helps prevent some of these, negative trends that lead to where we're now at a crisis point. So what we really want more of an emphasis on is that this is not only a mental health, crisis that's a component of it, but there's so much more that VA can be doing through the use of their benefits, right? Whether it's the GI Bill, whether it's some of their employment programs, whether it's housing, things like, the VA home loan or HUD-VASH and SSVF, that we need to focus on what those can also do to help be buffers against that, to make this, whole approach, whole effort to tackle veteran suicide, not simply leaning on it being a mental health clinical issue.
Taking a little more of a holistic view of this. Yeah, I think it's important. And part of that, we talked about a little bit here, is veteran homelessness. Now, the IB here wants to increase for veteran homelessness funding programs, but what we're seeing is very significant drops in veteran homelessness. So how does the need match up there with what we're seeing?
So if you fund programs like the SSVF, which is Supporting Services for Veteran Families, or HUD-VASH, which is Housing Urban Development VA Supplemental Housing Programs, of VASH. Supportive housing, thank you. Those are things that help veterans, get into some kind of a stable housing. It's better to keep them off the streets than get them off the streets. So there have been some positive news surrounding veteran homelessness, but frankly, one is too many. And it is something that hopefully we can tackle that. It's a problem that has a solution there, right? That is easy to at least identify the solution. It's hard to put into practice. But that's where we need to make sure that this is kind of a consistent approach, consistent effort, consistent priority, so that, even if they've reduced the number of homeless veterans, it's never enough until there isn't a single.
Exactly.
They want to continue to reduce that. And that requires that level of attention and a budget, the resources to do so. It is high intensity resource. Looking at what you have to do, because you're looking at all these different factors. They need healthcare, they need employment, they need housing, it's usually not just one thing. They've really gone down and spiraled down a number of fronts that require attention. And VA does have the resources and has an excellent program. But we also need to make sure that, for example, women veterans can access those resources. So in the community, if a woman veteran shows up with their children, or a male veteran, but they have their children, VA isn't able to provide the housing for them, the immediate housing for them. You may have to coordinate that with the community. So again, community partnerships for that and continued resources will, be needed.
Yeah, several areas of the IB touch on women's veterans. But Joy, I really want to get down to what does the VA owe to our women veterans?
Great question, Matt. Um, all of our organizations here, VFW, PVA, and DAV, have really highlighted women veterans over the last, decade plus. We've seen more women coming into the service, more women when they get out of service, turning to the VA for care. Um, and they deserve to have that specialized care that VA can provide. And the one thing, they've done a lot of research in VA on women veterans, so we know a lot about this population and about their unique issues that they face. And we've all been advocating for making sure that they feel welcome at VA, they have access to the same services and programs as their male counterparts, and that VA can train and have specialized clinicians with expertise in women's health. We know that they are a fragment of the population, a very small number, but that has increased exponentially. And they're up to, I think, 900,000 was the last number that we have from VA, with a huge increase just over the last year of women veterans utilizing VA. And that really required VA to expand all of its infrastructure in terms of women's health clinics, get these providers trained, and that's what we've recommended in the IB. We have to continue to make sure that funding goes to having those providers that have expertise in women's health. And they have a wide range. We have a younger women veteran population that's having babies and having families, and we have an older generation of women veterans who have other healthcare needs. And so making sure that those services are there across for their life as well, their lifespan, is important. And we know that VA does have to send out a lot of care into the community for women veterans. So we want to make sure that care is coordinated. For example, there's not enough women for VA to provide maternity care, for example. So that is provided exclusively in the community. And that's fine. And some of the specialty reproductive health services. And that's fine. But then the coordinators of that care are really important to make sure that it's an integrated care system for them as well.
Great. And I got one more question before we take a little bit of a break, but I'd like to hear from everyone here. If there's one thing readers could take away from the independent budget, what should it be?
That we're advocating for the true need of veterans' care and benefits. We've seen in years past that administrations have asked for what they think they should spend, right? Or they're asking for, almost their budget is a target that they're trying to hit instead of a true need. We're not constrained by, the Office of Management and Budget, whereas, the administration is. So, if we say we believe that, this program or whatever it might be requires this level of funding, it's based off of usage. It's based off of veterans. It's not based off of we're trying to stay under a certain target or we're trying to increase to a certain target. We believe what we're asking for is based on the true need. And if you go back and read some of our years past independent budgets, we've actually been a lot closer to what the need for VA that they've come back with supplemental requests. Even this shortfall, we said last year, we believe that they're playing games, that they're, using smoke and mirrors to get to a budget number that people will be satisfied with, but we didn't think that was the true need. Sure enough, they came out in July saying they're short on stuff. And with the additional monies they requested, it was actually a lot closer than what we put together than what the administration did.
Well, there you go.
I'm not saying that, we have better numbers than their actuaries and things like that. However, if you'll look at things in 10 years ago about IT requests, we've been closer to what they've needed. About 2-3 years ago, I think we were off by 0.5% with VHA numbers or something. It was very close. Then VA asked for a lower number because they have to stay under administration's arbitrary top lines. That's the biggest thing. We're asking for a true need.
Yep. And as Pat mentioned, I think he said it well, we try to cut through the budget gimmicks. We try to just look at this true need. And we listen to our memberships. We try to really keep our ear to the ground, hear from our members where they're having problems, and where we know there's a backlog in services. And we don't want to be where we were, go back to where we were in 2014. And there's been a number of reports since then that have really verified everything that we've said in the independent budget for years, is that the demand is there. You really need to provide the appropriate amount of resources, especially when Congress is passing legislation. And then making sure that those provisions are implemented in there, and additional pressures on VA. So again, that they're not trying to divert funds here and there, and soon all of a sudden you've got, a backlog of appointments, and access times are flailing, and they try to, readjust and do something. But if your resources are short, you're going to see that impact eventually somewhere.
And I think, when we start talking about billions of dollars, people tend to get a little, oh my gosh, there must be something in there that you don't really need. Maybe we could save something. And I think what's important about the independent budget, as Pat and Joy were saying, is that we really look at the individual veteran. What is it going to take to get them served? We're not here to serve VA. We're here to make sure VA serves veterans. So when we want, leaders to think about those billions of dollars, those represent veterans. They represent their families. They represent their caregivers, their children, their survivors. Those help them individually. So that, and as a grateful nation that recognizes the service and the extreme payment that many of them gave in service to us, is that we need to make sure that VA is properly funded. That's our only aim. Our aim is not to just make sure somebody at the VA has a job or whatever. No, we're here to make sure that veterans get the care and benefits that they have earned. And it's important that it is reminded that those benefits were earned.
Absolutely. I couldn't have said it better myself. Well, Heather, Joy, Pat, thank you so much for being with me today. And we're going to take a little break. When we come back, we're going to talk about veterans benefits. Stick with us. And welcome back. We're here to talk about veterans benefits. We have Christina Keenan, who is the Deputy Legislative Director for VFW, Marquis Bearfield, who is Assistant National Legislative Director for DAV, and Morgan Brown, National Legislative Director for Paralyzed Veterans of America. Thank you, guys. And I should add that you are all the authors of the independent budget. So first, the independent budget recommends a 20% bump overall recommended for the Veterans Benefits Administration. How have the veterans' needs evolved to justify this increase?
With the increase in claims that recently happened for fiscal year 2024, there were 2.5 million claims that were filed during fiscal year 2024. And in order to keep up with that increase in claims, a portion of that due to the PACT Act with the new service connections that were introduced, over 20 new service-connected disabilities associated with the granting of the PACT Act, that caused the spike in claims. And in order for VBA to be able to keep up with that increase in claims, FTE must be increased, consideration for either mandatory or volunteer overtime should be taken in consideration as well.
Yeah, I mean, we heard with the first group with healthcare, there are more healthcare users. There are more veterans using VA healthcare. And some of that did come out of the PACT Act. So the PACT Act, huge piece of legislation, which has enabled more veterans to access like the wide variety of VA benefits. So not just healthcare, but education, certain education benefits and disability claims, as Marquis mentioned. And we've got this huge group of veterans that came out of the global war on terrorism. So as conflicts, as we had 20 years of conflict, that group of veterans and veterans that came before them are using VA at higher rates. So we're looking at increases in the benefit side, even some of the education benefits as well.
I was going to say, I'd like to pick up on what Christina said regarding education benefits. First and foremost, whether you serve for 2 years or 2 decades, the transition from military service back into the private sector can be very challenging. And so the transition assistance program that VA conducts in conjunction with the Department of Labor and with the Department of Defense, couple other agencies, and is an extremely important transition tool for military service members. In recent years, there's been a project to kind of revitalize that program, a TAP 6.0 per se. And one of the things that we'll be asking for increased funding for is the necessary funds to put that new transition assistance program into effect. For a veteran with a complex injuries or illness, or a veteran with service-connected disabilities, the VA's VR&E program, Veterans Education and Readiness Program, is extremely important as well. And last year, we highlighted the need for additional resources to support this additional program. In 2024, 137,000 veterans filed a claim or attempted to enroll in this program, and that's unprecedented to have that number. There used to be a time where VR&E was kind of like that mystery benefit, and we were always wondering why veterans wouldn't enroll in it. The time has come. The word's gotten out. They understand the benefits that program offers, and more veterans are taking advantage of that. And then, in addition to that, you have vocational rehabilitation specialists, which have been added on in recent years to help improve the veterans' use of their education benefits and their GI Bill benefits and the like. We believe that this is be a good opportunity for VA to kind of help grow its own personnel within the VR&E program. So we're asking for some additional funding as well to try to make that happen.
And for folks who don't know, what is the TAP program?
It's kind of complex. So if I miss something, guys, please help me out.
No problem.
Certainly one of the primary focuses of it is to explain to the separating service member and their spouse the benefits and services that they're entitled for. So maybe it's the survivor benefit plan that they may be eligible for, GI Bill benefits, resume services, learning how to dress, learning how to do an interview,
Everything to do with VA benefits.
Insurance programs, employment programs to include VR&E. And being a product of the TAP program myself, I can tell you a lot of the complaints that I had when I transitioned, it's just very interesting to hear that a lot of those same problems are still being discussed nearly 30 years later after I medically retired from my service with the United States Army. So it's very interesting to see that some of those unique situations still haven't been resolved to this day. And with TAP 6.0, hopefully things can improve where departing service members and their families can put themselves in a much better position.
And just to add to that, a part of that TAP 6.0, VA has now incorporated service officers, so accredited claims assistants to come in during one day of that TAP class with VA so that they can offer their claim services to these transitioning service members. Some of the added costs that we're recommending is to coordinate that, to make sure that happens in every TAP class across the country and abroad, just so that can sort of complete the transition to VA benefits by having a specialist there that can help veterans file those claims for whatever kind of benefit that they're looking for. So some of the funding that we're recommending is to facilitate these programs, to staff these programs, and ensure that everyone that's eligible is able to access them, essentially.
I remember when I was in the Army, and I think TAP was an underutilized service, a program. I think I found out about it just after I got out, right? So I think staffing these up, increasing the resources here will just mean that we're able to give service members a much more seamless transition to veteran. But I want to go back to the PACT Act here. We talked about it as if this large expansion of veterans benefits that was passed in 2022. What about it is causing this big increase in veterans seeking benefits?
Well, I mean, part of it is veterans are more aware that they have benefits that they can apply for. So the PACT Act, part of VA's efforts to communicate about the PACT Act, has had this byproduct that more veterans understand that they can apply for benefits, that if they've filed a disability claim through the PACT Act, that they may be eligible for new benefits that they weren't prior to filing for those claims. So it's opened up a lot of opportunities for veterans that may have been on the fence or may have been denied some benefits before 2022.
There's also a huge outreach VA did on the PACT Act specifically to get more veterans enrolled, and that increases the benefits. And I think, again, it is often hailed as a burn pits bill, but it is so much more than that. It also expands eligibility for Agent Orange benefits for some presumptive diseases, for example. So it really does touch on multiple veterans, multiple generations of veterans, and future generations of veterans. I'd like to talk a little bit about survivors' benefits here. Now, what does the independent budget say about survivors' benefits?
I mean, generally, I mean, survivors, their benefits have not increased in since some of those benefits were created. So generally, as a group, we're always trying to advocate that survivors get the benefits that they need and that is sufficient to cover their needs, and that they are not an overlooked group. When we talk about veterans, we're also talking about their families and their survivors, and so we're always trying to highlight that those benefits are critical for this cohort, and we support those efforts.
So say one of the changes in survivor benefits that the IB supports is if you're a veteran and you've contracted ALS, and a veteran passes before the 8-year mark, of which the prognosis for survival is only 2 to 5 years. The surviving spouse normally would have been eligible to receive what's called the DIC kicker. It's about $350 more a month in addition to the baseline amount for dependency and indemnity compensation. So by its very design, ALS is a presumptive service-connected disease. So the surviving spouse is automatically eligible to receive DIC. But it's an impossible situation to where the veteran cannot possibly survive just to get across that arbitrary threshold that VA has established, the 8-year mark. So we're advocating that that there be an exemption for those surviving spouses, that if a veteran passes as a result of ALS, that they would automatically be eligible to receive the DIC kicker.
Is there anything else about veterans' benefits that people should know about?
The one caveat that I would like to add, when you talked about VBA, the very first question you asked, and talking about the additional funding that the IB asked for, the one component that I forgot to mention was about the backlog of cases. And VA strives to have initial claims taken care of within 125 days, or all claims resolved within 125 days. Right now, they're sitting at about 140 days. So those additional funds that we're talking about and the additional FTE that I mentioned earlier, as well as the overtime, will go to help bring that back down to that 125-day window where they would like to have those claims looked at, evaluated, and decisions made. So I would like to make sure that that was part of our conversation as well.
Yeah, I'll also add, we haven't touched in large part about some of the IT needs that VA has, and a lot of that is on the benefits side. So whether it's the faster processing of disability claims or the faster delivery of education benefits, there are a lot of IT needs with the VA's benefits system. Automation, AI, some of these things can really help reduce workload and have decisions come quicker. But we need VA to invest more in making those IT upgrades and long-term investments. So that's another main aspect of the benefits portion that we've covered.
And the only thing that I could think of to add is just a reminder that in many respects, the veterans' benefits that they receive are almost as important as disability compensation. And some might argue even more so important, in the sense that the majority of veterans that we encounter, they want to try to regain, the ability, trying to regain the status in life, become a contributing member to society, become independent. And important programs like TAP, like the GI Bill, that lays the foundation for them to do that. And so it's just extremely important that these programs not only be maintained, but in some cases expanded.
Thank you guys so much. Morgan, Marquis, Christina, thank you so much.
Thanks.
Appreciate it.
You can read more about the independent budget at independentbudget.org. Thanks for tuning in.